Welcome to Pharmacy Education Channel. If you like the content, then please don't forget to like, share and subscribe. We are studying unit number 2 of Social and Preventive Pharmacy. In this video, we will cover the general principle of prevention and cholera disease. First of all, we have to see what is meant by preventive medicine. Preventive medicine is a type of practice where healthcare system is promoted and health of patient is also improved. Main goal is to prevent disease, disability and health. Next point is types of disease prevention. Disease prevention refers to the strategies and actions that individuals, communities, and governments can take to reduce the risk of developing or transmitting infectious and non-communicable diseases. First type is primordial prevention. Primordial prevention refers to measures that aim to prevent the development of risk factors for diseases and health problems in the first place. Unlike traditional disease prevention strategies that focus on detecting and treating diseases early, primordial prevention aims to prevent the emergence of risk factors that lead to diseases. The goal of primordial prevention is to create healthy environments and promote healthy behaviors that prevent the development of risk factors, such as obesity, smoking, alcohol abuse, and physical inactivity. By preventing the emergence of risk factors, primordial prevention can reduce the burden of chronic diseases, such as heart disease, stroke, and diabetes, which are often associated with these risk factors. Second type is primary prevention. Primary prevention of disease refers to interventions and strategies aimed at preventing the development of diseases before they occur. This involves identifying risk factors and addressing them before they lead to the development of disease. Examples of primary prevention include vaccination. Immunization is one of the most effective ways to prevent infectious diseases. Vaccines stimulate the body's immune system to produce antibodies that can protect against future infections. Healthy lifestyle. A healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking and excessive alcohol consumption, can help reduce the risk of developing chronic diseases like heart disease, diabetes, and certain types of cancer. Secondary disease prevention refers to the measures taken to detect and treat a disease at an early stage in order to prevent its progression and reduce its impact on the patient's health. This is done after the disease has already developed, but before it has reached an advanced stage. Screening tests. These tests are done to detect the disease in its early stages when it is more easily treatable. Examples include mammography for breast cancer. Early treatment. Once a disease has been detected, early treatment can help prevent it from progressing and causing more serious health problems. Tertiary disease prevention refers to the measures taken to prevent complications and disabilities associated with a disease that has already progressed to an advanced stage. The goal of tertiary prevention is to improve the quality of life for patients who have already been diagnosed with a disease. Examples of tertiary disease prevention measures include medications. Patients may need medications to manage symptoms, prevent complications, or slow the progression of the disease. Surgery. Surgery may be needed to treat complications or improve the patient's quality of life. First disease we have to see in this unit is cholera. Cholera. Introduction. Cholera is an acute diarrheal disease caused by the bacterium Vibrio cholerae. The disease is typically spread through contaminated food and water, particularly in areas with poor sanitation and hygiene. Symptoms of cholera typically include severe watery diarrhea, vomiting, and dehydration. In severe cases, the disease can lead to electrolyte imbalances, shock, and even death if not treated promptly. Epidemiology. Agent is used to describe a specific biological agent, such as a virus, bacterium, or other microorganism that is responsible for causing a particular disease or illness. Vibrio cholerae. Host refers to an organism. Male, female, adult, children. Environment. Vegetables, contaminated water, street food. Factor agent. The disease is primarily spread through contaminated water and food, and is more common in areas with poor sanitation and hygiene. Here are some of the key factors that contribute to the spread and severity of cholera. Contaminated water and food. Cholera is transmitted through the consumption of water and food that has been contaminated with Vibrio cholerae. In areas with poor sanitation and hygiene, such as in refugee camps or urban slums, access to clean water and proper sanitation facilities is often limited, which can increase the risk of transmission. Host factor. Host factor refers to any molecule or protein that is produced by a host cell and is required for the replication of a virus or the survival of a pathogen. Cholera affects both male and female. It involves all ages. BT mostly occurs in children. Environmental factors. Poor environmental cleaning. Infected water or drinks. Infected meal. Lack of education. Incubation period. The incubation period is a time interval between the initial infection with a pathogen, such as a virus or a bacteria, and the appearance of the first symptoms of the disease. Incubation period of cholera is about 2 hours to 5 days. Mode of transmission. Spread from one person to another. Convalescent carrier. It is a person who has recovered from cholera but continues to carry the cholera bacteria in their feces for a period of time, which can vary from weeks to several months. During this time, they can unknowingly spread the disease to others through fecal-oral transmission, such as by contaminating food or water sources. Chronic carrier. A symptomatic carrier is a person who continues to carry and shed the cholera bacteria in their feces for an extended period of time, usually for more than 6 months, even though they may not show any symptoms of the disease. Chronic carriers can be a source of cholera outbreaks and can spread the disease to others through fecal-oral transmission, similar to convalescent carriers. Symptoms. The symptoms of cholera can range from mild to severe and typically appear within 2 to 5 days after infection. The most common symptoms of cholera include diarrhea. This is the hallmark symptom of cholera, and it is often described as rice water diarrhea because it is watery and contains flecks of mucus and white rice-like particles. Vomiting. Cholera can cause severe vomiting, which can lead to dehydration and electrolyte imbalances. Dehydration. Cholera can cause rapid and severe dehydration, which can lead to symptoms such as dry mouth, sunken eyes, decreased urine output, and low blood pressure. Muscle cramps. Cholera can cause painful muscle cramps, particularly in the legs and abdomen. Rapid heart rate. Cholera can cause an increased heart rate, which is a result of the body trying to compensate for the dehydration and low blood pressure. Laboratory diagnosis. The laboratory diagnosis of cholera involves the identification of the Vibrio cholerae bacteria in stool samples or rectal swabs from a patient with suspected cholera. Here are the common laboratory tests used for diagnosing cholera. Stool culture. Stool samples are collected from the patient and cultured in a laboratory to isolate and identify the Vibrio cholerae bacteria. Polymerase chain reaction. PCR. This is a molecular test that detects the genetic material, DNA, of Vibrio cholerae in stool samples. PCR can provide rapid and sensitive results, which can be particularly useful during outbreaks. Rapid diagnostic tests. RDTs. These are immunochromatographic tests that detect specific proteins or antigens of Vibrio cholerae in stool samples. RDTs can provide rapid results and are useful for quick diagnosis in the field or resource limited settings. Prevention and control of cholera. First is early diagnosis. Early diagnosis of cholera is important to ensure prompt treatment and prevent the spread of the disease. Cholera is a bacterial infection that causes severe diarrhea and dehydration, and it can be life threatening if left untreated. The following are the steps involved in the early diagnosis of cholera. Clinical evaluation. The doctor will take a detailed medical history and conduct a physical examination to look for symptoms of cholera, such as watery diarrhea, vomiting, and dehydration. Stool sample testing. The doctor may collect a stool sample to test for the presence of the cholera bacteria. This is usually done using a rapid diagnostic test that can detect the cholera toxin in the stool. Blood test. The doctor may also order a blood test to check for the presence of antibodies to the cholera bacteria. Epidemiological investigation. In areas where cholera outbreaks are common, public health officials may conduct an epidemiological investigation to identify cases and prevent further spread of the disease. If cholera is suspected, the patient should receive prompt treatment, including rehydration therapy and antibiotics. Rehydration is critical for treating cholera and can be done using oral rehydration salts or intravenous fluids. Early diagnosis and treatment of cholera can prevent severe dehydration and improve the chances of a full recovery. It is important to seek medical attention immediately if you suspect that you or someone else may have cholera. Second is medical care. The medical care of cholera is focused on treating the symptoms and preventing complications, including severe dehydration and electrolyte imbalances. Cholera is a bacterial infection that causes severe diarrhea and vomiting, leading to rapid loss of fluids and electrolytes from the body. The following are the medical care measures for cholera. Rehydration therapy. The most important aspect of medical care for cholera is rehydration therapy, which involves replacing lost fluids and electrolytes in the body. This can be done using oral rehydration salts, ORS, or intravenous fluids in severe cases. Antibiotic treatment. Antibiotics can help shorten the duration of the illness and reduce the severity of symptoms. Commonly used antibiotics include doxycycline, azithromycin, and ciprofloxacin. Nutritional support. Cholera can cause malnutrition due to the loss of fluids and electrolytes. Nutritional support, such as vitamin and mineral supplements, may be necessary to help restore the body's balance. Isolation and infection control measures. Cholera is highly contagious, so infected individuals must be isolated to prevent the spread of the disease. Infection control measures, such as hand hygiene and proper disposal of fecal matter, are essential to prevent the spread of the disease. Third one is immunization. Immunization against cholera is an effective way to prevent the disease and reduce the spread of outbreaks. The cholera vaccine is a safe and effective vaccine that can provide protection against cholera for up to 2 years. The cholera vaccine is usually given in 2 doses, with the second dose given 2 weeks after the first dose. The vaccine can be given to individuals aged 2 years and older, including travelers to areas where cholera is endemic and individuals at high risk of exposure, such as healthcare workers. The cholera vaccine works by stimulating the body's immune system to produce antibodies against the cholera bacteria. The vaccine contains inactivated cholera bacteria, which cannot cause disease but can still stimulate an immune response. The cholera vaccine is recommended for use in conjunction with other prevention measures, such as safe water and sanitation practices, hand hygiene, and food safety measures. The vaccine does not provide 100% protection against cholera, so it is important to continue practicing these other prevention measures. In areas where cholera outbreaks are common, the cholera vaccine may be used as part of a mass vaccination campaign to control the spread of the disease. Vaccination can be an effective tool for preventing cholera outbreaks and reducing the burden of the disease on affected communities. In summary, immunization against cholera is an effective way to prevent the disease and reduce the spread of outbreaks. The cholera vaccine is safe and effective and can be used in conjunction with other prevention measures to control the spread of the disease. Thank you so much for listening. Next part will be covered in part 2.